Okay, I'm all ears.
And what did it feel like?
Well, I happen to have clinic this afternoon, so I feel like I already started my clinic session. It felt like how a lot of my visits go.
Really? So it felt totally real.
Yeah, for the most part. I feel like, yeah, that is how our encounters go, where it's a balance of like wanting to give them tons of information, not overwhelm, and meet people where they are, you know, and give them some of the control around which direction our help is going in, what resources they want, what are they willing to share at this moment.
I noticed that you gave him options in a very natural, receptive kind of way.
Oh, yeah, thank you. Yeah, I hope it was natural, but yes, I generally, I try and do that. I don't know what you think of that, but again, otherwise I feel like, having been a patient myself, like, right, you get like all these handouts and 6 things you're supposed to do, and you may be able to continue half of them for half the time you're supposed to.
That's right.
You know what I mean? Like,
that's right.
I just wanted, yeah, I just like to acknowledge, you know, sometimes that it's hard to do everything that we're telling people to do.
Well, one thing that I really like is that you were very specific about things that he could do. So you kind of translated in words what was written in the handouts that you gave him. So it wasn't just this abstract reading material that he was supposed to take home, but you really made it real for him. That what's here is really everyday kinds of things. And you gave him a very specific example of what he could eat for breakfast, that one can always grab a banana or a, you know, energy bar. And he really seemed to respond well to that. One thing that I wondered about is, because I know that sleep is such a big issue, starting even in infancy, right, is one of the #1 complaints that parents bring, is sleeping problems with their children. And, you know, we spend trillions in sleeping aids.
Yeah.
As adults, as a society, nobody sleeps enough. Is there a reason that you didn't follow up with him when he chose 2 of the 3 things, and you didn't kind of remind him of the sleeping possibility?
Yeah, I know. I totally agree. And having 3 teenagers, I know how the sleep thing is, especially for teenagers, because I think their cycle shifts and they're distracted and they go to bed late and stuff like that. Yeah, I didn't, because I feel on sleep and good sleep habits, but I guess again, because I feel like it helps, especially in like an initial discussion, to let my patients have a, you know, some choice and what resonates, because I could hammer in sleep, but if that's not resonating, I feel like they may not do it. So I try and go with what they have, like what resonates for them, because they're more likely to follow through on it. And then maybe at the next follow-up, we can discuss further, like, how's sleep going, you know? And it's a great reminder, like, I should probably put in my note, you know, follow up on sleep. But I also want to make sure he comes back. And so if I'm like pounding on something, like, you know, really pushing something that he doesn't identify as a problem, then, you know, he may not want to come back. So, but I don't know, you know, I see how opening it up again could be helpful too.
I'm just realizing how much a pediatrician, just like a parent, needs to balance what is realistic and doable and acceptable for one's patient and what is the laundry list of everything included. And I'm seeing the choices that you are making, which is trust comes in stages. I am building a relationship. This is just the second time that I've seen him. And the most important thing is to make this place a place where he feels that he can offer things. And the fact that he told you that these adverse childhood experiences happened to him is already huge. So you were deciding to go with what he offered and to wait to build more opportunities later on. Thank you for helping me understand your reasoning. That makes a lot of sense to me.
Oh, yeah, thank you. I mean, you always have a beautiful way of putting things. So it sounds like I do everything purposely. I think also some part of it's just like, you know, and like we're just winging it ourselves. And I actually don't mind if my patients see that because it just makes us all a little vulnerable and human. And I was thinking how like whether I'm a pediatrician or an adult doctor, and since my practice goes up to 24 years of age, I'm like sometimes on that adulthood more. But adults too, like, I think they like having choices too. And so like trying to get someone to stop smoking or who really hasn't identified that as the problem. You know, we have to like ease into it, I think, for them to, for a conversation to happen. So, yeah.
And what you are saying, Anda, is so important because in the triads model is the relational approach rather than the top-down approach. And you are bringing your expertise and you are speaking of your expertise, but you are doing it in a way that is very reciprocal and very respectful. And where you give the explicit message that the patients are the ones who are leading their lives and you are there as a helper. And that increases the chances that they will trust you and pay attention to what you have to recommend.
Yeah, and what I love about triads is just keeping in my head the, you know, what happened to you, how is it impacting you, and what are the strengths that help you cope? Because in the visit, you never know what's going to come out. And so like sometimes I get flustered or I'm not sure how to respond. And it really does help for me, you know, to have that mantra in my head. So that I can weave it into the conversation.
The way you kept affirming him and remembering the things that he does that are so productive and so proactive was beautiful. I think that it gave him so much dignity and it reminded him that he's not defined by his adversities, that he really has very successful coping mechanisms and that you are there to notice them and remind him of them.
Mm-hmm.
One thing I noticed is how smoothly you read his signals that he wanted to talk about what happened to him. He kept saying, yes, well, how come? And he wasn't coming across that clearly. And then you really invited him to say that these things had happened to him. And then you reiterated the connection that there might be between the things that happened to him and some manifestations of stress. And again, you reminded him of all the things that he's doing to help himself. And that, I think, takes leaning in on the part of the pediatrician to really, when a patient is giving almost nonverbal signals that they want to talk, that you are helping them put those signals into words. And I think it was very helpful for him.
Yeah, thanks for pointing that out. I think it's a balance. I think, you know, most clinicians would pick up that there's a lot of curiosity about a question. And then it's like in our heads, we're thinking, how do I get into that without, you know, turning the person off or, you know, being too blunt. So I usually try and bring in, or, you know, I've noticed that some of my other patients, when they're asking more questions about something, you know, maybe it's relating to them, you know, like just backing in that way, to see if anything else will come out.
You were reading between the lines for him, and you were helping him along. It was so developmentally appropriate that adolescents often give us nonverbal signals and are so relieved when we put those signals into words.
Yeah.
And the other thing that occurred to me, and that is that the overarching theme of the entire visit is that you gave him choices. You gave him the choice to tell you or not, the choice of what resources he wanted, and then of the resources you offered, which ones would be most helpful to him. That's very empowering.
Yeah, I hadn't thought about that, but I do think that works for adults and adolescents.
Yes.
So they feel like they have some control.
And even for toddlers.
Yeah, definitely for toddlers. we're really all just toddlers in different sizes.
I agree with you. Thank you.
And I think for providers, there's a fear of, you know, what are they going to say? I think as a provider, I have a fear of like, what happens if the screener is positive, or they have something that they reveal that's really challenging and takes me by surprise, and I don't have the right answer. And I appreciate having in my mind again, like that just because something really challenging has happened or difficult has happened doesn't mean that it's defined this person and that's not what should come out of my mouth. It's like, do you think this is impacting anything, you know, about your health today, versus, you know, making assumptions. So that's what I also appreciate having that, you know, just that reminder in my head with triads.
Which I think that the way you frame it for yourself is remembering that having adversities increases the chances, but it doesn't predict that people will respond. And the vast majority of people have sufficient coping mechanisms that they are able to continue in their healthy trajectory with some glitches, which everybody has, but essentially functioning well in spite of the things that happen to them. But we also want to be there for help in strengthening those resources. Thank you.